Okay, this says, my question is related to alignment. I believe that my pelvis is a bit rotated, right side more forward and maybe up, which makes my right shoulder also a bit forward and reflects in my right psoas and iliacus, as well as tightness of my right hip flexors. Can you please suggest some exercises for this situation and how to address that more forward-oriented side in relation to the other side of the pelvis? Yeah, that's a great question. Very common, right, to have that either high hip or pelvic obliquity. The complicated thing with answering that question is that it needs a body read because it can be coming from so many places. So, for example, if we have just a very classic high hip where one hip is up this way, right, then that's sort of a side bend of the spine. And then we work on lengthening out this sideline, maybe the QL. You can also see this inner thigh becomes tighter and this outer thigh becomes tighter. So then we're stretching the high hip inner thigh and the low hip outer thigh. However, if one side of the pelvis is posteriorly tilted, it will look high at the front and rotated forward, but the SI joint will actually be low at the back. So that's like an anterior posterior rotation of the pelvis. That's almost more common than just the classic high hip. And then that requires balancing of the alignment of both sides of the pelvis. So she's saying that for example, her right hip is posteriorly tilted. So it looks forward and high, but it's actually an obliquity. This hip flexor will be the one that is achy and complaining, but it's actually the long side, right? Because we're pushed forward and weighing into it this way. So the other side needs stretched. And then if you're posterior, the sits bone is locking into the hamstring. So you would need to free up the top of that hamstring. So the other option, and there are actually sort of an infinite number of options because we are very complicated and three-dimensional and everything is connected. But she may appear as having a high right hip, but in fact, it's an internal rotation of that leg. We see how that internal rotation, and that could come from the femur or the shin, or even from a medial tilt of the foot. That will make the appearance of a forward high hip, but it's coming from the foot, the shin, the knee, or the thigh bone. So that would then be addressed more by looking at the alignment of the leg. Yeah. So those are a couple of options, but there are lots of options. So the good news is that our practices are designed to look for balance and evenness and to create balance and evenness. And they are done with a lot of attention to pelvic alignment, leg alignment, even core engagement. And then we're doing the unilateral work to make sure both sides work evenly. One simple thing to do is to simply put a block under the pelvis and just explore the sensation of if it's even, and not just the sacrum, but both pelvic innominants and the iliac crest around the back and the fold of the hip at the front. So all the work that we do in this position, right, we do some of this stuff, will help to recreate that evenness there. And then when we're doing some of our, let's say it's the leg issue instead, when we do some of our leg work, especially when it's closed chain. So this one, for example, if I have that twisty foot or twisty shin or thigh issue, as I press back, my alignment is not quite right. And then instead I could find the foot as though it's on a wall, the knee facing right forward, and the active lifting and alignment of all of the muscles of the leg. So we can check out, is the pelvis even? Am I lined up properly through the bones with my leg rhythms and maintaining that as I move? And if we work that on both sides until the muscle and the tissue becomes even, and we have awareness of even, then it will correct that misalignment that's causing the pelvic imbalance. Yeah, and so with a question like that, where a body read would be necessary to know the cause of the high hip, you are welcome to come to the Q and Correct interactive classes, because We can do body reads of all of you within those, and we can do specific corrections about the pelvic obliquity. So